Hello, it is 12 p.m. and it is time for me to give my patient her insulin medication for her diabetes. This is a subcutaneous injection that it can either be given in the outer aspect of the arm, the outer area of the thigh, or the abdomen area. You're going to use a 25 to 30 gauge needle, or you're going to use a 3/8 to 1 inch needle. And the first thing that I'm going to do is compare the provider's order to the MAR. This is the first check. So I have the patient's name, EJ, date of birth, 4/14/70, no allergies. The orders is regular insulin at 12 p.m. subcutaneous for diabetes to control glucose. The first thing that I'm going to do is hand hygiene. I'm going to gather my materials. So I have my insulin needle, which is a 1 milliliter 29 gauge. I have my alcohol pads. I have my insulin, and then my hand sanitizer and gloves. So what I'm gonna do, open up the needle. First thing that I'm gonna do is clean the vial. Let it air dry. Using the double OK method, I'm going to gather my insulin. And I'm going to pull back 50 units. You want to make sure that the syringe is free of air bubbles. It's right at the 50. I'm going to use my scoop method to recap my needle. And then I would label it with insulin and the 50 units and the patient's name. This is going to be my second check. So again, this is the insulin, regular insulin 50 units that I'm going to administer at 12 p.m. for the diabetes. Because it is insulin, I'm going to compare with the second nurse. So nurse number 2, this is 50 units of insulin. Here's the MAR, 50 units. It has been compared. Now, I'm ready to go into my patient's room. I'm gonna take my insulin, my gloves, my hand hygiene, as well as the orders. Good morning, Miss Erica Jean. How are you?
Good, how are you?
Good, my name is Jasmine. I'm a student nurse and I'm here to administer your insulin for today. Do you have any allergies?
No.
Okay. Can you please identify yourself?
Erica Jean,
And your date of birth?
4/14/70.
Thank you. So today I plan on giving you your insulin injection in the outer aspect of your arm. Is that okay?
That is.
Okay, I would like to provide privacy if necessary. Sure. Also, okay, so now we're ready. I'm gonna do hand hygiene. I'm gonna do my third check here. So again, I have my 50 units of insulin that I'm gonna inject into the outer aspect of your arm, and it says 50 units on the MAR as well. I'm gonna put my gloves on. Okay, I'm gonna take a look at gonna roll your sleeve up, Miss Jean. Sorry. Gonna make sure the skin is free, no sores, none of that. So, I'm gonna use the double O. First thing I'm gonna do is clean the injection site in a circular motion, starting from the outward end. Using firm pressure. Okay, I'm gonna let that air dry. I'm then gonna use the double OK method. I'm gonna bunch the skin. All right, I'm gonna bunch the skin. I'm gonna inject the needle at a 45 to 90 degree angle using my dominant hand so the skin is bunched. I'm gonna inject slowly over 10 seconds. I'm going to remove the needle at the same angle it was inserted. I'm going to use my gauze to apply light pressure. You don't want to rub or irritate the site because it will irritate the skin. I would then throw my needle into the shark's bend. Lastly, I would educate the patient, let her know that again, this is the insulin used to control your diabetes. Also, if you have any problems, you can use your call bell to let me know if you need me, okay?
Okay.
The last thing I would do is I would document where the insulin was given, which was the outer aspect of the right arm. It was given at 12 p.m. and 50 units was given.